Okay, in today's project we're going to be making our master impressions for our simulated patients. So we want to try in the custom trays into our simulated patient's mouth, ensuring that the tray extends approximately 2, but really no more than 3 millimeters shy of the depth of the vestibule. If in trying your tray in your patient's mouth you feel like the tray is slightly overextended, you can bring in the handpiece, shorten areas. If you feel like an area is sharp, you can round it off. If you feel like your tray is a little bit short, then we either have to use an alternative material for border molding, something like a green stick modeling compound, or we have to take a new impression and make a tray. Now for an actual patient up on the clinic, we will actually want to make the holes, the relief holes that you see being made here in the video after the border molding, because you want to be able to evaluate the retention of your border molding. Sometimes for the project it's a little bit easier to make them at this point. So for our simulated project it's fine to make your vent holes because you're not going to be getting a peripheral seal with the typodont patient anyway, but with a live patient you're going to want to make those relief holes after your border molding. When applying the adhesive, you either want to pour some material inside the tray itself or using a medicine cup. Please never use the brush that comes in the bottle. You're going to dry the area of the tray that you're going to be border molding, and you're going to apply a layer of adhesive. And then you're going to bring in the Exafast clinically. Here in lab for the simulated project we're going to be using a heavy body polyvinyl. So after you dry and put the adhesive on, you inject the Exafast material onto the area labeled A, and in this area we want the patient to be moving their jaw from side to side, opening wide and puckering and smiling. As you move more anteriorly on the tray, again drying, putting the adhesive, injecting the material in that area labeled B, it's going to be more puckering and smiling, much more orbicularis oris muscle coming into play and the buccinator muscle affecting that area of the denture. As you move anteriorly to the anterior segment, again drying the tray, putting on the adhesive, and then injecting the material on this area. You want to have the patient puckering and smiling. You want to pinch the lip so that you record that labial phrenum, making sure that you're not pulling on the flange to foreshorten the material. So we're going to continue to put the adhesive on as we get to that posterior area. Again, we're not extending the tray in this area, we're just adding some material on top of the tray to complete our peripheral seal. So in a patient, we should have a retentive tray at this point in time. Because of this being not really close to a clinical situation, using the heavy body polyvinyl material as our border molding material for our simulated project, I have no problem with you going ahead and injecting the entire periphery all at once. You should have 2 to 3 minutes of working time, so that should be plenty of time. Just make sure you put a nice heavy bead around the periphery, and then you're going to want to slightly lubricate your typodont, and then you're going to seat the tray on. Now when you see me seat the tray, you see how my knuckles get a little white. I want to seat it completely. Then once I'm done with that, I'm just going to hold the tray and have the patient go through their border molding movements. And you're going to complete the same thing in the mandible. Okay, once the material is set, for our simulated patients, we want to take something like a buffalo knife. You want to very gently with a blunt end peel back the typodont in that area, get up and get underneath the tray of your impression, and then you can just gently lift and it should come out. Now you're going to have some excess material that has flowed around and has become technically part of your impression. You want to take a nice sharp blade and go through and cut those areas out of the tray, because remember, our border molding is just customizing the impression tray. It's not taking the impression, it's customizing the tray. So we're going to take a blade and trim out all of that excess material so we have just a nice proper extension of the tray in the peripheral areas, in the vestibular areas. Okay, so you can see here we got a nice impression of our vestibular extensions. Now, when you do go to the mandibular arch, the different areas you're going to start off with, you're going to start off with that area A, again, adhesive, drying adhesive, and then you're going to place in the patient's mouth. Again, in this area, it's going to be a lot buccinator muscle, so a lot of puckering and smiling. As you place dry and place adhesive into area B, this is going to be an area where the patient's retromolar pad comes into play. And so having the patient stick their tongue out, put some pressure on your finger or the tray to try to elevate that area or to flex those muscles. In area C, again, anterior segment, just like the maxilla, you just want to be careful that you register those frenum attachments, but that you don't foreshorten the material in that labial vestibule. Area D is where the tongue is going to really start coming into play because the tongue is very active with that lingual frenum attachment. So sticking the tongue out, sticking the tongue around, putting some pressure against your finger or the handle of the tray. And then in area E, that's where you're dealing with the distal lingual extension, and you're going to be having the patient, again, putting pressure as much as they can swallow. But again, that's the area that's most commonly underextended. As we move to the master impression here, we're taking a little bit of soap, again, as a detergent. You can put this on either prior to your border molding. You really want to try to do it prior to your master impression to ensure that the impression material doesn't stick excessively to the typodon. Again, making sure it isn't pooling. You just want a nice shiny layer. You don't want to have any material pooling because that's going to impact the surface, which can affect your impression. Now you're going to take your border molded impression tray and you're going to now put adhesive in the tray. Now remember, like I said earlier, your border molding is part of the tray now. It's just properly extending the tray. So you can see we want to capture that vestibular extension in our impression. And so we're actually putting adhesive not only all across the internal of the tray, but we're also making sure the adhesive is out buccally over the vestibular extensions of the tray. You want to make sure you always express some material prior to putting a tip on. And then once you put the tip on, you want to make sure that as you're injecting the material, you maintain the tip in the material. This is what's going to significantly decrease the amount of bubbles that you incorporate in the material. So when you move to a new area, you always want to try to keep the tip of the syringe of the material still inside of previous material so that you don't incorporate more bubbles. After you've injected what you feel like is enough material, again, not a lot of room has been made in this impression tray for material, so we don't need an excessive amount of impression material. But then you want to take the material, and as you can see in the video, we're pulling the material up and over the vestibular extensions. So we want to make sure we capture in this wash impression, we want to make sure we capture those vestibular extensions. Once you've spread things out evenly across and as smoothly as you can, you're going to evenly put pressure, and you can see again the white knuckles. I'm going to seat that down, and then once I see the material stop flowing, then I'm just going to take my finger, relax, and just hold it in the patient's roof of their mouth. Now again, you're going to want to have the patient go through their border molding movements while you're holding this because you want them to mold this impression material. You'll do the same thing in the mandible, and then removing the tray from the typodon is the same way we did with border molding. You want to get in and pull back the typodon around one of the corners, making sure you don't tear the typodon, but get up underneath the tray. It's important you get underneath the tray of your impression and then gently just lift up. When you take it out, if you do have any small voids that need to be filled, you can add a little adhesive, mix a little bit more material on the countertop, and then fill those little voids. Now the important thing here is that you do not want to overfill any of those voids. Now we want to carve our posterior palatal seal or mark it in the patient's mouth, and we do this by palpating, knowing where that vibrating line is, knowing where that depressible tissues are. Then we're going to mark it in the patient's mouth. We are not going to do this in our simulated patient as far as marking the posterior palatal seal. But you're going to mark it in the patient's mouth, put the impression tray back in, and it's going to transfer. That's going to help us as far as carving in the posterior palatal seal once we've poured our impression. So just demonstrating here, showing you putting it back in the patient's mouth and where it would transfer if we did that on the tympanods. Now you want to take some boxing wax and make a ring of boxing wax. And what we're going to do is we're going to take an equal mixture of pumice and plaster and put them into a mixing bowl. So it equates pretty closely to 1 bag of plaster to 2 bags of pumice. The reason why we add the pumice to the plaster is because if you've ever tried to trim straight plaster, it's kind of tough if it's thick enough. And so we put the pumice in to help break up the plaster so it's basically a weak plaster. Now once you've poured your 1 bag of plaster and your 2 bags of pumice into a bowl, you want to take a mixing spatula and you just want to kind of mix up the particles. You want to make sure that the particles are all mixed up together so you don't have just a big clump of plaster or a big clump of pumice. You want to try to mix those particles up as evenly as you can. As far as water, again, you can use the recommended manufacturer amount of water. The only issue whenever you use the recommended manufacturer's amount of water is that you're probably going to end up with a very runny mixture of pumice and plaster, which is okay. It's just going to take a lot longer for the material to set. So usually what I want to do is I want to make a rather stiff mixture of pumice and plaster. So I want all the particles wet. So I'll add water as I need to make sure that I wet the particles, but I want to make sure that I have a relatively heavy mixture of the pumice and plaster. So we have a pretty good consistency here, so I'm going to take the material here and place it inside of the boxing wax. And again, the main reason why we're doing this again is because we're pouring both the cast and the base at the same time, which is something different than we do in fixed prosthodontics, where we pour the cast and the base separately. So you place it in there. I just kind of tap the material to get a nice smooth surface. And then what you want to do is make sure that whenever you're placing the impression into this material, you want to keep about 6 millimeters of space between the vestibules of your impression and the sides of the boxing wax. So we want to frame our impression. So you can see I'm placing it in the middle, and then you just kind of gently shake it, and that vibrates the pumice and plaster mixture so that it'll start seating down. You may end up, as you can see in the hamular notch area, you may get up with getting a little bit of material flowing in that area, and that's not a big deal. That is very easily removed whenever you go to trim this. So at this point, we're going to let that alone and let it set. It will probably take approximately 10 to 15 minutes for that material, depending on how wet you have it. When we move to the mandibular arch, because of its shape, you can see we have a little bit more of a flatter surface to the boxing wax for this one. Again, to maintain that 6 millimeters of space around the tray. And since we have more of a flat surface going from retromolar pad to retromolar pad, we want to be able to have that flatter surface with our boxing wax. So with the maxilla, it's going to be a little more rounded. With the mandible, it's going to be a little flatter as far as at that posterior end of it. So again, mixing the pumice and plaster so I get a nice even mixture of particles, and then I add enough water so that I get all those particles wet, but I still want to have a relatively stiff mixture of the material. Once I've mixed everything up to the point where I feel like I have all the particles wet, then I'm going to take and I'm going to place it, just like I did the maxilla, into the boxing wax. Okay, so we place the material in the boxing wax. Again, I'm just going to tap it around and make sure that I have a relatively smooth surface to be able to place the tray into. And the difference about the mandibular arch, and this is the one that panics most students, is because of the fact that you have those distal lingual extensions that are relatively high and the retromolar pad extensions that are relatively low. Usually you end up, in order to get this material flowing up far enough to those distal lingual extensions, you're going to have a bit of material flowing into the retromolar pad area. Again, I just need to make sure that I keep the external surface or the lateral surface of this impression at least 6 millimeters away from the periphery of my boxing wax. But if I have some material of my pumice and plaster flowing into the retromolar pad areas, that's not a big deal. Once things have set, you can remove the boxing wax. And the first thing we want to do is we want to carve and expose our vestibular extension of our impression. Now we're trimming it down to a flat surface, and we want to make sure that we expose at least 2 to 3 millimeters of the buccal roll of our vestibular extension. Now at this point in time, if you're going to err, you're better off on carving down too far and exposing more vestibule than less vestibule. You may have a little bit more to trim as far as the cast is concerned, but you'd rather trim your cast than have to trim, than not have it in your impression. Excuse me. So here we're switching to the mandibular arch. The maxillary arch is really exposing that vestibule. Posteriorly, it's coming relatively straight off. In the mandibular arch, again, buccally, it's relatively straightforward, where you want to make sure that you carve away and expose the vestibule. Where students often make the mistake is as they come around posteriorly towards that retromolar pad area, is they don't continue down and open up the retromolar pad area. Here I'm carving around the lingual, same thing, I'm exposing some of that lingual vestibule, but the retromolar pad area is the area where students often make mistakes. So as you see, what I'm doing here is I'm carving out the retromolar pad and I'm exposing the retromolar pad. This is the common mistake that students make, is they just carve it out like that. The problem with carving out the retromolar pad just like that is that you only end up with a small tower of stone that is reproducing the retromolar pad, and there's not really much support behind it. And that's part of the purpose of this, what we call land area, or this amount of stone that we're having extend beyond laterally the vestibular extensions, is so that it'll reinforce the impression or the cast that we're going to be making. So in order to appropriately do that, what we need to do is we need to actually carve out the retromolar pad area on this impression. So as you can see, we're doing here is we're actually carving down and exposing the retromolar pad very openly. But if you think about this boxing wax or this pumice and plaster mixture is framing the cast that we're going to be making. But if you look at it now, if you think about now the stone that you put in that area, you can see how right now we probably have too much, but it may be a centimeter of stone reinforcing the retromolar pad area. Makes it so it won't break. So that's the same thing we're going to do on the other side, is we're going to again trim down the vestibular extension all the way down towards the retromolar pad, and then exposing that retromolar pad openly so that we can have stone whenever we pour our cast that's actually going to reinforce the retromolar pad area. Again, showing you that area where you want to carve it out. Again, we're showing you here carving it out and exposing that retromolar pad area. So now we're going to have a nice reinforcement of the stone in that area. So once we've trimmed everything, we got all of our vestibular extensions exposed the way we want to. We now have things framed. We've got things trimmed now vertically the way we want to. Now we're going to move things over to the model trimmer. When we go to the model trimmer, what you want to do is you want to still leave, roughly 4 to 5 millimeters of material lateral to your impression. So as you go around and trim, I don't want to trim too much away because, again, I'd rather have these lateral extensions be too wide than not have them enough. So once I trim them down to where I'm happy with it, I'll bring in the mandibular arch. Again, you got to be careful of those distal extensions of those retromolar pad areas. The lateral or the buccal aspect right as you leave the retromolar pad area is probably the most common. Once you have things trimmed to where you feel you're comfortable with them, then you want to take one sheet of base plate wax and put it around the maxillary arch, and you want to use golden microstone to pour this. So we want you to use 2 packages of gold microstone, and you want to vacuum mix those and pour it. But here you can see we're applying a sheet of boxing wax. So now how we framed our cast with, or framed our impression with this boxing, or the pumice and plaster, now the boxing wax. Now we can pour, and we want to pour a nice at least centimeter to centimeter and a half base, again from the highest point. So in the maxilla it's usually the palate. The mandible, it will be the tuberosity, or the distal lingual extension. But we want to have a minimal thickness of a centimeter to a centimeter and a half that we pour on this base. So you're better off, again, pouring too thick of a base than not enough. So the maxilla is relatively straightforward. The mandible, because of those distal lingual extensions, we usually have to put 1 sheet of base plate wax low to make sure we get down to those retromolar pad areas. And then if you look at it here, we obviously, from those distal lingual extensions, could not pour a thick enough base to have a centimeter thick base on our impression or on our cast. And so normally you have to put a 2nd sheet of base plate wax over the top of that in order to be able to give yourself an adequately thick base. Now again, you're going to probably use 2 packages of golden microstone. Again, use proper water to powder ratios, vacuum mix them. But you may have to, once you pour it, you may actually have to use a 3rd package to get a nice thick base on the mandible. So again, pour them in vacuum mix golden microstone, use 2 packets, possibly a 3rd, and then you want to leave